Ms. Len Ragsdell is a nurse with the Arkansas Department of Health. She received her RN degree from Euler in 1985. She began her nursing career at Baptist Hospital in Little Rock, where she was a cardiac nurse. After 8 years of nursing, she and her husband adopted 2 little girls. Len was able to be a stay-at-home mom for the next 10 years and had the opportunity to participate in many school activities with them. Len returned to nursing in 2004, working for the health department in the local health unit in Faulkner County as the clinic nurse.
Okay, good morning, everybody. I'm happy to be here. I'm happy to see so many men here too. I've met so many nice people already. That sounds like y'all have a lot of fun here. I mean, y'all got all kinds of things going on. So when I went to college, all I had time to do was concentrate on studying because I had to study hard. Miss Yolanda's already sort of introduced me and told about me. But I am the BreastCare coordinator for Central Region, and that encompasses 7 counties in our Central Region, which are Pulaski, Faulkner, Lone Oak, Saline, Grant, Garland, and Perry counties. So as she said, October is Breast Cancer Awareness Month. Every year, in October, that comes around. So I'm just going to share some information with you about the risks and signs and symptoms of breast cancer, and also some myths that we'll talk about that maybe you've heard about. So I'm going to try not to bore you with a lot of statistics because that is boring. My main goal is just to give you some good information for you to use and for you to share with friends and family, because I feel like there's a lot of misinformation out there maybe about breast cancer. First, I'd like to share something that was just made the news just yesterday, and I had actually gotten an email about it, but if you watch the news, they had about a 10-second blip on the news last night about a new study that has been done by the CDC, the Center for Disease Control. In 2014, approximately 631,604 persons in the United States received a diagnosis of a cancer associated with, are you ready? Being overweight and obesity. And who has not, maybe some of you haven't, but me, I hear that every time I go to the doctor. But that it represents 40% of nearly the 1.6 million cancers diagnosed each year. These cancers are related to overweight and obesity. We're higher among older persons, so 50 and up, that's me, and higher among females than males, higher among non-Hispanic Black persons and non-Hispanic white persons. Then endometrial, ovarian, and postmenopausal female breast cancers accounted for 42% of new cases of overweight and obesity-related cancers in 2014. So first I'd like to just talk about some of the risk factors. And these are some things that we don't really have much control over. Number 1, being female. And women are 100 times more likely to get breast cancer than men, even though men do get it. It is rare, but men do get it. In the United States, in 2016, there were close to 250,000 new cases of invasive breast cancer. But I like to put a little positive note in here, that there are more than 3 million breast cancer survivors in the United States, and y'all have one right here. And this includes women that are being treated and who have completed treatment. Another risk factor is just getting older. And some of you may think, oh man, I'm getting old, my bones hurt. But you know, I'm happy to be getting older and to be able to get older. And most invasive breast cancers, about 80%, are found in women aged 55 and older. So if you're not getting your mammograms, I really, really want to encourage you to get those every year. I get mine every year, so it's not a is just a good tool for finding any problems that there might be. Women should start at 40 unless you find a problem. And any kind of problems that you find, you want to go to your doctor just to have it evaluated. All right, then there's those inherited genes. About 10% are thought to be hereditary. Breast cancer, y'all might have heard of that BRCA, B-R-C-A. Well, I had to look it up. What does that stand for? Well, it just stands for breast cancer, and they took the BR and the CA. But the breast cancer susceptibility gene, about 5 to 10% fall into that category. Family history, another thing you can't really do much about. Women with a family history of breast cancer are at an increased risk, but less than 15% of women, less than 15% with breast cancer have a family member with the disease. In other words, over 85% of women who get breast cancer do not have a family history of it. So it's just important to, keep going to the doctor, getting your mammograms. If you have a first-degree relative, and that would be your mother, sister, or daughter with breast cancer, this almost doubles your risk. If you have 2 first-degree relatives, it increases your risk about 3-fold. So don't think just because there's no history in your family that you're immune to it. Important to take care of our health. All right, now another risk factor for women starting your period before age 12, going through menopause after age 55. And it seems that the longer a woman has reproductive levels of hormones is what makes them more prone to it. The longer you have these hormones, the more risk you have. If you menstruate for more than 40 years, she has a particularly high risk. If your ovaries are removed early and no hormone replacements are given, your risk of breast cancer is greatly reduced. It's not exactly a cure-all, however, since it would be greatly increase your risk of osteoporosis. So, it's always something, isn't it? And, we do what we can, but there's always something out there. If you've had a hysterectomy, it may or may not influence your vulnerability to breast cancer, depending on what was removed. If you still have your ovaries, your body's still going through hormonal cycles, even though you don't have periods anymore. All right, and one more, radiation therapy. Now, this is not just going to the doctor and getting a chest x-ray because you got pneumonia or something. This is if you receive some kind of radiation therapy to the chest area as a child. All right, now there's a few that we do have some control over. Alcohol use, being overweight, again, there's that overweight thing, and the level of physical activity. And it's recommended that you get about 150 minutes of moderate activity a week. And somebody like me that gets about this much activity a week, and that's a lot. Okay, so those were the risk factors. Now I would like to talk to you about the signs and symptoms. It can occur anywhere in the breast, but about 50% occur in the upper outer quadrant and the subareolar region, just because that's where most of the tissue is located. Breast lump or under the arm area. Most of these are non-cancerous, but definitely you want to have them checked out. A skin change. Now, I'm taking everybody's observing their body. Women, you need to be doing your self-breast exams each month. And that would be, like for the younger women, about 10 days after you started your period. If you are not doing that anymore, then just pick a time during the month to do that. So you do that every month. It's really important. A lot of women find their own breast cancers. Okay. The skin change would be like redness, dimpled skin that looks like an orange peel, inverted nipple, breast enlargement, nipple or skin retraction. All Now then, spontaneous, of course that spontaneous just means happens by itself. Nipple discharge. It can be clear to watery, yellow in color, or bloody. Any of these absolutely need to be evaluated by your doctor. All right, pain is the most common breast-related complaint. There's actually, I thought there was just two, but in my research, there's one more that they're putting in here. But cyclical is caused by the fluctuation of hormones, during the month when you have your period. And it's usually on both sides. Non-cyclical, that's a hard word to say, is less common, almost always in one specific area, rarely a sign of cancer. Most commonly it's caused by a non-cancerous cyst. However, 15% of the patients diagnosed with breast cancer presented with breast pain. Then the non-breast origin, which was new to me, it's not really a form of breast pain, even though that's what it feels like to the patient. Usually in the middle of the chest and doesn't change with your period. Most frequently it's arthritic pain, so you younger ones probably don't need to worry about that. In the place where the ribs and the breastbone connect. And arthritis called costochondritis. When men have it, they think it's a heart attack. When women have it, they think it's breast cancer. And anything, you want to just go to your doctor and have it checked out. We talked about your self-breast exams, important to do those. All right, now some of the myths that maybe y'all have heard about. Most breast cancers run in families. What have we already learned? 85% of them don't have any family history. There's nothing you can do to lower your risk of developing breast cancer.
That's not true. Exercise.
Yeah. Yes. The thing, after that study came out yesterday, I decided it's time to change my eating habits. Alright, so yes, maintain a healthy weight, exercise, limit alcohol, and breastfeed when you can. Okay, bras and antiperspirants can cause breast cancer. Have y'all heard that one? Y'all ever heard that? Well, that's not true. If you have, that's not true. There's no evidence that any of that causes, so keep wearing your deodorant, okay? Alright, regular mammograms prevent breast cancer. If you go every year and get your mammogram, is that going to prevent you from getting breast cancer? No, it's just a tool to detect. Yeah, thank y'all for participating. Let's see, they can find cancer early. Okay. Now, I want to share some words that I found from a breast cancer survivor. That I think her name was Barbara. It wasn't anybody I knew, but I thought her words were very encouraging. Cancer is a very individual experience. Each and every survivor, and we are all survivors from the day of diagnosis, will have a unique walk down the cancer path. However, we will all have challenges, successes, and failures that have been met and dealt with before us, and will be met and dealt with again after us. It behooves us, therefore, not only to avail ourselves of the knowledge of those who have gone before us, but to endeavor to leave behind whatever we can that can benefit those who walk the path after us. I thought those were good words that could really be applied to just about anything that we do in life. Just a little bit, okay, this is the audience participation thing. There was a survey done, I think it was just last year sometime, asking women why they had not had a mammogram ever, or maybe they hadn't had one in many years. And what do you think maybe their number one answer was? Do you think?
No insurance.
No insurance?
It hurts. Yeah.
It hurts. And I'm telling you, sometimes it can. I think it depends on
Or
the
they check themselves.
Cause cancer. I heard that.
which we know that that's not true. And what did you say?
That they check themselves.
Okay. And all those were on the survey. And all those were no on the survey. the number one reason why women don't go for a mammogram, or maybe it's 10 years since they had one, is because they were just too busy. Just too busy. Because there are finances available, you know, so that's all it was. So, it's important to take time for our health. And just, I want to leave you just with one quote that I found that I thought was very appropriate for what we're talking about. It's take care of your body is the only place you have to live. So I really appreciate all of your time, and it's been very nice meeting all of you. And I think y'all will have my email if y'all have any questions. Do y'all have any questions?
I have two
that
questions.
I might be able to answer.
You said something about cancer being related to obesity. How are the two related? I thought cancer was more of a invasion of cells or something, like maybe smoking or something like that. When you hear cancer, you think of something going into your body. But
And that is true. And basically, on the cancer cells are cells that I read that literally says they're cells that just go crazy. They go rampant in your body. They can, get more of them in there. Multiply is what I'm trying to say. The obesity, I'm not really sure, but we know that obesity can be the problem of a lot of things.
So maybe it's
diabetes.
You get cancer through food and stuff like that.
I don't think it's particularly the food. I think it's just us being overweight. I mean, it can cause diabetes and joint pain and a whole lot of different things like that.
Okay, final question.
Uh-oh.
Are those highlights in your hair? Or is you naturally, because your color is beautiful. Okay, that's all I want to know. Okay,
It's
good.
very natural. I'm waiting for it to totally grow out.
Adding to what she was saying, with the overweight thing, would it possibly be that the bigger you are, the more the cancer cells divide to like cover those areas? That's why you kind of have to be smaller. So with the obesity thing, I'm not.
Well, I think being overweight, like I said, it just puts you at risk for a whole lot of things. And they've just done this study, which I think was really about over a 10-year period, that just showed that overweight and obese women are just, it just shows up more in them. So I don't, really know about all that. You could probably go online and read more about it specifically, isn't it?
I understand what they're asking because Yolanda is right there, and if you look at her,
and she's small,
she's nowhere near obese.
Right.
So
that is just a risk factor because yes, I've known very thin women that get breast cancer. I've known 25-year-old women that get breast cancer and 60-year-old women that get breast cancer. So you're not.
It's just something that happened.
So is this an attack of the red blood cells? Is it sort of like sickle cell? Would they be in the same? It's not. It has nothing to do with cell count.
I don't think so. Yeah, that sickle cell is something that you're aware of.
Yeah. Okay. I see.
Anybody else? Anything?
So I have a quick question for you, and I know normally they would say, years back, that in your late 30s or early 40s would be the perfect time to start getting your mammograms and get tested for breast cancer. What age group now would be more required, like the starting age?
Okay, well it's still 40, but if you have like a strong family history or have any kind of problems, your doctor might suggest that you start at 35 just to get what they call a baseline, and so they can have that to compare to later. Of course, if you have, ever have problems, find a lump or anything, you want to go to the doctor. Anything else? Okay, it's been fun. Y'all have a great day.
Thank you. How dare you make me laugh like that?
Let's give it up for Miss Len Ragsdell, y'all. Miss Len, you gave some great information.
Yes.
If you don't mind, Miss Len, I want to kind of say a few things about what I've learned about breast cancer, going through it. some of the risks that Ms. Ragsdell said, I didn't fall in that category. I wasn't overweight, I wasn't a smoker, I exercised, led a pretty healthy life, didn't have a history of breast cancer in my immediate family. So, saying that, you just have to be proactive. And as a young girl growing up, I learned to pay attention to my body. As Ms. Len said, do yourself breast exams. If you notice something that's not right and you catch it early, which I caught mine early, and I do believe that early detection saves lives. The later you wait, the less likely you have your survival goes up. I'm saying that to say that be proactive with your bodies. Learn your family history. Go to your doctors. Something else I wanted to say. I forgot. It was on the top of my brain. But, you say what? Yeah, definitely go to the doctors. But anyway, it'll come back to me later on. But according to the American Cancer Society, breast cancer is the second leading cause of death among African American women. So that's alarming. So we know from that a lot of times you can't be too busy to pay attention to this one body that you have. So you got to stay proactive. You want to get to whatever is going on early. You want to catch it early. So, and I've learned that from the American Cancer Society, about 400 men a year develops breast cancer. I was just in a race, Runway for the Cure, and it was a guy that had been, that was part of the models, and he was a breast cancer survivor. He was in his 7th year of survival. So men, you're not exempt. Nobody is. So you have to just stay proactive with your bodies. And saying that, and I'm gonna end right there. I don't want to take you guys too far. I'm not a doctor, I'm not a nurse, I'm a survivor. And I kind of researched breast cancer because it was something that I had to go through, so I wanted to learn a little bit more about what it is. And for me, I'm starting a organization, and it's geared towards early detection for our African American women. So be on the lookout for that, My Pink Mood. Anyway, that concludes our chapel. Thank you guys for coming out.